Employees have the right to either agree or disagree with whatever has been demonstrated and written. And OSHA also gives you a phone call. They encourage you to call them for an open discussion. It's an informal conference. It gives you an opportunity to talk about your violation and to have a better understanding. Options. You can discuss ways to correct the violation, discuss issues concerning the penalties, discuss proposed abatement dates, resolve disputed citations and penalties, obtain answers to any other questions that you may have. Now there's some violations that I'm going to go through that are pointed out during your discussion. First one is willful. Employer demonstrated either an intentional disregard to employee safety and health. Now this is very acceptable in the Dominican Republic, and believe it or not, but not in the United States. It basically has disregard for human life, possibly not death. The next one is serious, where there is a potential for death or serious physical harm which exists from one or more practices or operations or processes which have been adopted or in use in such places of employment unless the employer did not and could not with the exercise of reasonable diligence. Now, on the other serious note, there are types of violation where accident, incidents, or illness could be most likely to result from hazardous conditions, not cause death or physical harm. These are penalty-driven violations. Now, these are conditions where an employer has implemented a measure different from one specific standard, no direct or immediate relationship to safety or health conditions. These conditions do not result in a citation or a penalty. Now the next one is failure to abate. Exists when previous cited conditions, practices, or non-compliant equipment has not been brought up to compliance, or it may have been corrected and repeated violation. You may be responsible for paying a penalty at this point. And the next one is a repeated offender. An employee is cited for repeated violations even if it has been up to 5 years and it's the same violation. And a citation has become in final order of the OSHA Review Commission. Repeated violations can bring a civil penalty. So after you discuss your differences of opinion, you have an option to contest. You may not agree with what OSHA has cited you for. So the penalties itemized on the citation and notification of penalties are payable within 15 days of receipt of the penalty notice. If, however, you contest the citation or penalty in good faith, OSHA will suspend abatement and penalties of these items contested until OSHA reviews of a higher court. Now you have a right to an attorney. The OSHA assigns the case to an administrative law judge who usually schedules a hearing in a public place close to your workplace. Both employees and employers have the right to participate in a hearing and contain all the elements of the trial, including exam and cross-examination of the witnesses. Now you also have the right to appeal. Once the administrative law judge has ruled any part to the case, you may request further review. Present your case again. At this point, you may be required to comply. So either fix the issue at hand, notify OSHA by letter, signed by a member of your management that the appropriate corporate action, corrective action is in place. So put a notice up to where the violation originally occurred. Let your employers know or employees know that you have fixed the issue and that it is now safe to move about the cabin. This shows that you have made an effort to correct the issue at hand. So pay the fine. The fine can range depending on the severity of the violation, length of the inspection. You can also negotiate a payment plan especially if the penalty is high. Last but not least, establish an injury and illness prevention program to reduce the number of severities in the workplace. Assign an OSHA expert within your company, so that way you won't let it happen again. And that concludes my presentation. And next, I would like to introduce Krista, who will be talking about hospital safety with OSHA. Thank you.
So thank you, Chastity. And as she just mentioned, my name is Krista, and I'm going to be talking about safe patient handling in hospitals. I chose to talk about this because my mom's a nurse, and they have safe patient handling programs in her hospital, and she said that they are very effective. So according to the Bureau of Labor Statistics, the likelihood of injury or illness resulting in days away from work is much higher in hospitals than in construction or manufacturing. And I found that really interesting because we usually consider those two industries having a lot of hazards. Injuries and illness. When an employee gets hurt on the job, the hospital is the one that's going to pay a hefty price, and they pay for lost wages, medical costs, temporary staffing, turnover costs when an injured employee quits, and decreased productivity and morale as employees become physically and emotionally fatigued. Hazards include lifting and moving patients on and off beds, helping them use the bathroom or shower, getting them into wheelchairs, whether people can fall, slip, trip, or the use of needle sticks. Those are all hazards in hospitals. Workplace safety also affects patient care. Employees lifting patients can put both parties at risk. The patient is at risk of falls, fractures, bruises, and skin tears. Caregiver fatigue and injury and even stress are all linked to higher risk of medication errors and patient infections. Updating facilities and patients being assessed are also important for this program to be successful. And it's easier and more cost-effective for facilities to design for safe patient handling programs during remodeling or construction rather than during retrofit, which is when you just replace an item that broke off of the equipment. Every patient should be assessed on a regular basis since they all have different characteristics and abilities. The assessment should be focused on the patient's mobility, which will help both the patient and employee at risk. The U.S. Department of Veteran Affairs developed its assessment criteria and plans for safe patient handling to help care providers do a better job. Management support. Support from the top levels of hospital administration is a very important aspect of safe patient handling programs. Employees appreciate knowing that their managers care about their well-being and are much more inclined to follow through with the safe patient handling if management stands behind them. Studies show that the initial capital investment in these programs and equipment needed to safely handle patients can be recovered in 2 to 5 years. And although there's a lot of infrastructure, equipment, and training that has to do with safe patient handling, hospitals with successful programs have found that the long-term benefits far outweigh the economic costs. Employees should check the mobility of their patients regularly and communicate their level of mobility and need of assistance. Patients and their families should be engaged about the need for mechanical equipment. OSHA has a patient education poster that hospitals use to promote the use of safe patient handling programs. Management should include more than just the workers with direct patient care and safe patient handling. Departments such as maintenance, engineering, and laundry departments also play big roles in safe patient handling because you need clean sheets, you need slings, and if a wheelchair or bed breaks, someone needs to come and replace it. Safe patient handling and equipment having the right amount of equipment in hospitals is a vital part of this program. Having frontline staff who are using the equipment to test it out is very important because they know what kind of equipment they need to be successful in safe patient transporting. Equipment should be chosen on the specific lifting, transfer, and movement needs of each patient. Equipment should be stored in easy, accessible places. That way patients won't have to wait long and other tasks won't be delayed. and equipment should also be maintained. If something's broke, they should fix it right away. There are many benefits, which include reduced injuries among patients and caregivers, decreases in lost time and workers' compensation claims, increased productivity, higher quality in work life, staff retention, and better patient care and satisfaction. These benefits make it worth it for hospitals to invest in safe patient handling programs. Education and training is another important factor for this program to be successful. It's important that employees know how to use the mechanical lift equipment comfortably, and another way for the program to be effective is by encouraging employees to use the equipment properly every time. Evaluating the procedures of this program will help hospitals ensure that their program is effective. It will also ensure that hospitals will be continuously improving the problems, fixing issues, and focusing on long-term success. Employees should be notified of results, which help motivate them to continue the good work. Every program is going to need adjustments when first implemented. Feedback from the employees using the equipment can help the program to keep getting better and make adjustments. The Association of Occupational Health Professionals published a guide to help hospitals implement the safe patient handling programs, which is a good resource for hospitals to use to be beneficial. Policy and program development is another important topic for this program. Policies establish expectations that staff will use the safest techniques to accomplish patient handling tasks, and that administrators will provide equipment and resources necessary for employees to do their job. Policies should address the importance of using lift equipment correctly and following proper handling procedures to ensure both patient and worker safety. Safe patient handling policies should be designed as a pledge from administration and staff to protect patients and workers, and should clearly articulate goals and expectations. So there's a hospital in Ohio that used their own safe patient handling program, and they found an 83% reduction in lost time and injuries in just 3 years. So this is just proof that these programs do work and are effective over time. And now I will pass it on to Joanne, who will be talking about construction.
Okay, so once again, my name is Joanne, and I will be discussing OSHA in the construction industry. As many of you know, the construction industry is a high-hazard industry, and workers engage in many activities that expose them to serious hazards, such as falling from rooftops, being struck by heavy construction equipment, electrocutions, and entrapment, to name a few. So the Directorate of Constructions, aka DOC, provides workplace safety standards and regulations to ensure safety working conditions for the nation's construction workers, and ensures agencies are enforced to follow the laws and standards. It also establishes the Construction Compliance Guideline and Assistance Program. So their mission statement is to serve as OSHA's principal source for standards, regulation, policies, programs, and assistance to OSHA, other federal agencies, the construction industry, and the general public with respect to occupational safety and health. It ensures that OSHA has guidelines to follow to ensure safe working conditions for all construction workers. So when it comes to OSHA and the construction industry, they also have an advisory committee. When it comes to OSHA and the construction industry, they also have an advisory committee on construction safety and health. It is a continuing advisory body established to provide advice and assistance in construction standards and policy matters. There are currently 15 members on this board, and all meetings are open to the public. So nearly 6.5 million people work at 252 construction sites nationwide on any given day. The fatal industry rate for the construction industry has the highest national average. So what OSHA does is provide workers and employees with information to protect and ensure their safety of people involved in this type of career. OSHA requires focused inspections that are a part of each construction site, like Todd mentioned. They help prevent the leading hazards, which I previously mentioned, such as falls from roofs, being struck by falling objects or being hit by vehicles, being caught in cave-ins or equipment, electrical power lines, and power tool risks. So OSHA requires construction companies to focus on certain trainings such as general safety and health, safety training and education, employee exposure, emergency action plans, and first aid if necessary. There are many companies you can hire to provide this requirement training to your employees,